I didn't see you there. I'm Dr. Sheets. Today we're going to discuss the assessment and treatment of an emergency laceration in an Angus bull calf. Come learn with me. Does this scene seem a little too familiar? Fence in the eye is an epidemic not just in people. It also affects Angus bulls around the world. Oftentimes it can lead to a phone call much like this one.
Please, doctor, my bull calf got injured. I think, oh, yeah. I think he got caught in a fence or something. Yeah, please hurry. Thanks, I don't know what to do. I'm a simple farmer.
I'm on my way.
Thanks. Alright, bye.
Oh great, 2 of my students are already on the scene. Now ladies, what's the first thing you want to assess in the triage of my favorite bull, Z514?
Well, the first thing to do after a thorough visual examination is to evaluate your ABCs and determine if the patient is stable.
And what are the ABCs?
Always be careful, or all be calm.
Does anybody want to try and not be wrong this time?
I'll do it. So A stands for airway, B stands for breathing, C stands for circulation, and D for dysfunction. So for airway, he had a patent airway and his lung sounds were normal. He had an elevated respiratory rate for breathing, but possibly due to excitement. Circulation, he had pink mucous membranes, distal pulses were normal. D, he was ambulatory, adequate muscling, normal mentation, bright, alert, responsive, and conclusion, he's stable.
Great, and how might we classify this wound?
Well, it's a 0.6 centimeter laceration of the lower eyelid OD, and since it looks pretty open, fresh, and traumatic, I would call it a contaminated wound.
And how can we tell Z514 is in pain?
So an elevated respiratory rate, his was 44, as well as shying away and blepharospasm, which he's also exhibiting.
Great job! You can come and see me after class for your prize. Man, that is good. Much like humans, bulls also need water to live. Sometimes in an emergency, we have to give fluid intravenously. How might we decide if we have to do that?
In terms of the perfusion parameters, we're looking for mentation, mucous membrane color, capillary refill time, heart rate, pulse quality, and cold extremities.
That sounds great! By now I'm sure you're asking, Dr. Sheets, shouldn't we be doing something about that bull's eye? Right you are. And now, Dr. Michoacan will tell you about our plan.
We call this wound management strategy, and for this bull, it's very simple. We have to clean lavage, debride, suture with apposition, and apply an eye patch.
But won't the bull gore you to pieces? I don't want to have to go through that again.
No, of course not. That's why we'd use something called chemical restraint. And for this healthy 6-month bull, I would use a combination of alpha-2 agonist and opioid, xylazine and butorphanol.
One last question. Don't we want to give the bull something before we stab it in the eye?
Sure, we'll use what's called the local anesthetic. In this case, lidocaine sub-Q.
Why do we want to use lidocaine over the other blocks?
Well, lidocaine is much more potent than procaine, plus it diffuses into the tissue better. And it lasts 1 to 2 hours, which should be sufficient enough time for us to get our job done with this bull.
That's great! Now that we've figured that out, let's get down to fixing Z514. Since this is a fresh wound, how would we go about doing that?
Well, that depends on what kind of healing we want. There could be primary intention healing,
which is when you go in surgically and close the wound with good appositional closure.
or second intention healing,
And that's when you leave it open and manage it as an open wound.
Or third intention healing.
That's when you let it granulate and then close it when the wound is small enough.
Well, I think we're gonna do primary intention healing because we want to close it ASAP.
So what layers should we be concerned about?
Epidermal and subcuticular.
What fundamental properties should the suture material have?
Well, Dr. Sheet, there's a couple of properties we want to consider when choosing our suture material. Our first property would be monofilament versus multifilament. Since we're working on the skin, our preference is probably going to be for monofilament, just because the braided multifilament can be a nidus for infection.
Another property of the suture will be if it's absorbable or non-absorbable. In this case, it probably doesn't matter because we're going to check back anyway in about 10 to 14 days, and at that time, if it's healing well, we're going to remove it. So we can just use whatever we have available.
So another property would be the tensile strength, which is determined by the suture material and thickness. And for our bull, we ought to use a 2-aught or aught.
And what suture pattern would be appropriate?
For a skin closure, we've got a couple of options. We can do a simple interrupted, we can do a simple cruciate, or a simple interrupted cruciate, or we can also do a buried intradermal pattern. All of those would be acceptable.
So now that we've sutured up Z514, are we done?
No, I think we should give our bull some analgesic medication. So flunixin, meglumine, also known as Banamine, is the most frequently used NSAID, and it's because it's been approved for anti-inflammatory and antipyretic in the US.
What great answers! In summary, there are a few major take-home messages from this video. Proper suture material for eye laceration. Types of analgesics and anesthetics used in cattle. How to manage a periorbital injury. Indications for postoperative analgesics. Also, here are some commonly used instruments in the stitch-up pack we would use to help Z514. Towel clamps, forceps, needle drivers, scalpel handle, number 15 blade, number 10 blade, hemostats, Metzenbaum scissors, curved Mayo scissors, straight Mayo scissors, and gauze. Thanks for stopping by. I hope you join us for more Adventures with Bull and Sheets.